welcome back to Nordic's video series on supply and demand as it relates to healthcare. As we discussed last time, we're talking about queuing theory and as it applies to the healthcare supply and demand. When we talk about queuing theory, it's really important to understand that there is an inflection point at which the number of patients that you can provide care for relative to the number of patient safety or outcomes or decreased satisfaction comes into play. And you want to be able to manage the number of patients that you're seeing effectively. So you might set targets for how many patients you can see and what's an acceptable wait time or satisfaction score. Well, as you start to set these targets, you then can get excited. You're like, oh, you know what? I want to increase my referrals, or I want to try to increase patient retention. And those are great things. As a high-performing organization, you can provide care to a lot of patients, and you can increase your patient base and revenue. But as you increase the number of patients that you see, you start to use your capacity faster. And as you see more and more of different types of patients, you increase your variability. And as you increase this variability and you increase the number of patients, well, your line shifts. And now, all of a sudden, you are able to see fewer overall patients before you start to see decreases in safety and outcomes. So as an organization, it's really important to be able to monitor these things, be able to understand how satisfied are our patients, what type of outcomes are they receiving, and where are they at in terms of our ability to care for them. And as a mindful organization, it's going to be important for you to recognize when this curve has shifted and then how to be able to bring the curve back. And we're going to talk about that part next time. So check back in, and thanks for watching.